Hello, I hope all of you stay healthy in COVID-19 situation. 대응하는 이그저그레마스카. My name is Changbin Yoon. I'm an ophthalmologist, which means eye doctor. I'm working as a global doctor of KOICA at Rastesa Hospital, which is located in Addis Ababa, the capital city of Ethiopia. My main job is educating and training new color operation skills to Ethiopian eye doctors and nurses, and doing color surgery for Ethiopian patients who are suffering from severe cataract. I hope this lecture will help you to understand how we can examine the eye usually and especially in Ethiopia. This lecture includes over 60 slides, so I will explain in a brief and rough. First, we should know that what the basic function of the eye is. There are three main functions of the eye: seeing accurately, widely, and dimensionally. In each case, representative inspection methods include the checking of visual acuity, visual field, and the stereoscope test by myriad equipment. And there are additional eye functions, cosmetic and curing. For checking these functions, we consider using exophthalmos in whose eye pop out due to thyroid disease and beauty in dry eye syndrome. Each eye exam should be done by the purpose. First is to evaluate the eye function. Second is to find and grade the abnormalities of the eye. We can separate the eye exam by how we measure them. The first is a subjective method. There are many exams checked by subjective opinion of patients. For example, visual acuity and visual field. These are very important and essential exams, but there are some possibilities of lying and errors because these results are depending on the patient's answering and responding. The second is an objective method, which includes cerebral exam and refraction and etc. These are done directly by ophthalmologists and or optometrists and nurses, so there are low possibilities of the errors or lying. There are many causes of blindness. In the left diagram, we can see the cataract is the main cause of low vision and blindness in Ethiopia. The cataract occupies almost half of the blindness in Ethiopia and also in the world. You can see the results in the right diagram. Cataract is the lens past in the eye, mainly caused by aging and the sunlight exposure. As cataract develops, patients feel blurring, visual acuity dropping, darkness, and eventually become blind. Besides the cataract, there are many causes of blindness. Glaucoma is the disease in which the optic nerve's functions are decreasing gradually without specific symptoms and eventually cause the narrowing of visual field. Glaucoma is very common in Ethiopia, and we can slow down the progress of this disease by controlling the intraocular pressure with eye drops. But the cost of these drugs are not cheap, and some new and more efficient and powerful type of drugs are hard to get in Africa. ROP is the abbreviation of retinopathy of premature, which causes congenital blindness. Because of the development in the medical technology, many premature infants can survive at very early stage. But these infants require the treatment in the incubator, and unfortunately, this can cause the ROP. Some causes of blindness are decreasing in comparing to the past, but relatively, all causes are increasing for the correspondence of increasing the popularity of the world. At the sub-Saharan Africa, the prevalence of childhood blindness is 5 times more than the established economic world. And each year, 500,000 new children become blind for various reasons. And 50% of children who become blind before 2 years, eventually dying before age 5 years. But this is important. We can make a prevention and the treatment for 40% of childhood blindness. In poor and developing countries, there are many children who need appropriate nutritional support. If nutritional deficiency happens, many states can cause blindness. For example, if a child suffers from vitamin A deficiency, conjunctiva, the white part of the eye, georges, some kind of dryness can be developed. It causes cornea, the black part of the eye, and scarring and opacity that bring severe decreasing of visual acuity, and it is hard to treat at late stage. Night blindness also can be developed in vitamin A deficiency. So, for the prevention and the treatment of the many causes of blindness, we need the exact examinations of the eye states and the functions. For that, we need many equipment and the supplies. All these following lists are not only for pediatric eye training, but also for others. I will explain some essential equipment and examination methods among these from next slides. Visual acuity checking is the most important examination for the evaluation of the eye function. For old people, we should check the visual acuity not only at far but also at near for the evaluation of their presbyopia state. In most cases, we check each eye one by one by closing another eye. We should record exactly what the patients are calling from the large letter of the visual acuity chart. I will show some kinds of visual acuity checking methods and the visual acuity charts. There are many types of visual acuity chart. Usually, the charts are made in the form of some numbers or letters or pictures. From above to bottom, large letters are gradually decreasing of the size. If the patients can see exactly the letter which the examiner pointed, the examiner will point the smaller one until the patient can't see and answer correctly. If some patients can see 3 more letters of 5 in the horizontal line, we can record the visual acuity which indicates the line. In infant who can't be expressed by him or herself, we can use another type of the visual acuity chart which are made in some line patterns. If the infants are heading or indicating to the visual acuity chart of a smaller gap of line patterns, we can expect the amount of some visual acuity of them. We should check visual acuity in bright area, but if it is not possible, we can use some bright chart itself. The center and the right pictures show some examiner is indicating the letter E, the capital E, and the student is answering which direction of the letter E is not blocked at Rastes Hospital Visual Acuity Examination Room. If some patients are wearing or using their own glasses already, we can check just the visual acuity in wearing the glasses, because usually patients can't read any small letters far without their own glasses. And after the refraction exam, I will let you know what that is a later slide. We put some eyeglasses for them and check the corrected visual acuity again. In some severe cases, patients can't read at all visual acuity chart at far because of their very poor visual acuity. In these cases, we first check whether they can count fingers at 1 meter, 50 centimeter, 30 centimeter distant from the patients. If they fail that, the examiner moves hands in front of them and ask about they can recognize the motion. If they can't either, then the examiner should check about that they can perceive the light in front of them by turning on and off of the illuminator. Because all the results of these exams are checked by subjective answering, some meaning patients try to deceive their exam results for their bad purpose. In this case, We can check the visual acuity by objective method using VEP, Visual Evoked Potential. Visual acuity means the ability of seeing of a smaller letter or object at some distance. So we can record and express the visual acuity by various methods. In South Korea, we usually record by decimal from 2.0 to 0.1. In Ethiopia, the record is written by fraction from 12 per 6 to 6 per 60. If someone's visual acuity is lower than 0.1 or 6 per 60, then we record counting finger, hand motion, and perception of light. If we are recording someone is blind or someone has a visual impairment, that means he or she has very poor visual acuity in better eye. So, if someone already lost one eye but has good visual acuity in another eye, that means he or she is not blind. In better eye, if someone's visual acuity is lower than 20 per 400, we can legally call him or her blind. Visual acuity exam does not require any specialty. We just need some visual acuity chart and make a distant line and educate how they can answer during the exam. It is very important to find who are suffering low vision or visual impairment from childhood, because these problems can cause educational problem eventually. Many children don't know their visual acuity precisely and what is the real good visual acuity by themselves, so they can ignore their low visual acuity as normal. Considering all these reasons, elementary school screening of eye exam is a very essential program for the children. KOICA and the Vision Care have done this job for about 10 years in Ethiopia, but for the COVID-19, all this activity is postponing now. At previous 13 slides, I mentioned the refraction exam shortly, so I will explain in detail. We can see all objects by the refraction of the light. When the light comes into the eye, some factors, including cornea and the lens, make a refraction, and the light is coming to one point and makes the form of the objects on the retina. If someone's refraction is normal, the light from the outside arrives at retinal position properly and then makes the form precisely, so he or she can see clearly. But if someone's refraction is abnormal, the light hardly gets to one point or arrives before and behind the retinal level, which makes the form blurry, so they can't see clearly without glasses. We call this situation myopia or hyperopia. In astigmatism, the light arrives at various retinal positions, so patients see double or blurry vision. These are some examples when refraction errors happen. Ametropia means normal vision, so the driver can see clearly and perfectly at far and near. In myopia, the driver can see clearly only at near. In hyperopia, the driver feels hard to see near. In astigmatism, the driver can't see all distance clearly. We can check the refraction state by automatically or manual. Manual exam requires some expertness, so only the experienced ophthalmologist or optometrist can perform. However, this method only needs a retinoscope and a skiascope bar, and these are relatively cheap. Automated refraction machine does not need specialty or expertness, and it can be done by anyone under some education in a brief. So we can examine many patients in a short time, and it also gives us other information about the corneal radius. From this, we can calculate the IR power for cataract operation. But this machine is very expensive and heavy and delicate and also needs stable electric power. In Ethiopia, KOICA and Vision Care donated some of these machines. But because of the poor electric supply and care, the machine broke several times and need to repair right below photo, screen monitor problem. It is hard to repair in Ethiopia, so we should send it to Korea and bring it back after the repair. Of course, all these processes need time and cost. Scaloscopy racks or bar contain plus and minus lenses, so we can use that refraction exam. When we want to about the patient's glass power, we can use a lensometer. After the refraction, then we can check the corrected visual acuity on the basis of the results of the refraction. So we need a trial lens set. Some patients can feel dizziness and no comfort when the examiner puts some glasses which is based on the result of refraction exam. Then we should ask them about the comfort and the seeing where over changing some trial lenses. But in severe cataract or corneoplasty cases, we cannot check refraction because the light can't yet enter into the eye or refract. When we do not have any equipment for the exam of refraction, or we can't check the refraction in severe cataract or corneal scarring patients, how can we guess about the patient's best visual acuity? Pinhole device can make a light enter through the eye and make some amount of precise film on the retina, regardless of the refractive errors. If a patient can read the visual acuity chart with the pinhole device, we can suppose that there are no severe condition of the eye function of them. Strabismus is the condition of abnormality in eye position and movement. We call this also as a lazy eye because strabismus patients do not look like to focus. Usually, it can be caused by conjunctivity. If a child who suffers from strabismus at early stage, it can make a poor development of visual acuity and poor stereo vision and also cosmetic problem. If strabismus occurs suddenly at old age by central nerve palsy or trauma, patients feel dizziness or double vision. The purpose of the strabismus tests are two. The first is to define what kind of strabismus. If eyeball is deviated internally, we call that esotropia. And if deviated externally, we call that exotropia. If deviated superiorly, we call that hyper. And if deviated inferiorly, we call that hypo. The second purpose is to reveal and record the amount of deviation. Prisms are used to measure the amount of deviation by the degree of angle. Prism can utilize the center of the light refracts in strabismus patients. There are two types of the prism apparatus, bara type and the individual type. If a small angle deviation can be corrected by prism, we can prescribe prism glasses for the patient, and we do not need to consider the operation. Occluders are very essential for strabismus exam, but if there are no occluders, we can use just the hands instead. Through the opaque occluder, we can check the movement of the unoccupying eye. Through the translucent occluder, we can check both eye movements. If a child has a low vision due to amblyopia, which is caused by strabismus, we can patch the normal function eye. In this case, the child will try to use the deviated eye to see the world because he or she can't see through the patched eye. By this patching treatment, the low vision of the deviated eye will get better visual acuity gradually. But if it is too late, most later than 8 to 9 years old to patch, the treatment effects are very limited. So we should find the amblyopia early through the elementary school, kindergarten eye exam screening. The examiner educates the patient should look at one point to fix it far or near. Then the examiner, who sits in front of the patient, shine the light to the patient's side. And by using the occluder and the reprise, the examiner can try to check and evaluate the type of strabismus and the amount of deviation. It's very hard to do in uncooperative patients, especially in infants or very young children. So the patience and the ability to catch a moment of movement in a short time is needed. From Korea, the specialist of the strabismus, professor of the University Hospital, visited Ethiopia several times through Vision Care Strabismus program. They trained many Ethiopian eye doctors how to test and operate for strabismus. We can see the normal 9-directional movements on both sides in the left pictures. In the right photo, upper A shows whose left eyebrow cannot go up and down properly. Below B shows whose left eyebrow can go up and down naturally after the operation. So, we should always take photos of the strabismus patients whenever they visit eye clinic. By comparing the photos of before and after, we can find the improvement or worsening of strabismus state between gaps. Currently, everyone has a smartphone, so we can easily take photos and store those. If patients have a large amount of deviation, we can check them by occluder or prism. But if patients' deviated angle is very small, we can use ROSE for that light test. In this case, the patients who wear green-red curly glasses can respond to various types of for different dust illumination. When patients cannot recognize the pop out of the pictures in the stereo test book under wearing polarized glasses, we can guess there are some small amount of abnormality of strabismus and the possibility of poor developing visual acuity. It is easier than worse for the test, so we adapt this test to children usually. Visual field means how amount we can see widely. We only can see clearly in very narrow area within 30 degrees when we look at some object. But simultaneously, we can also see outside of the object without focus changing in some wide range, although these fields are felt somewhat blurry. Human can see more widely horizontally than vertically. Visual field can be damaged and narrowed by various reasons. Glaucoma is the most common cause of the visual field defect. High intraocular pressure over 21 mm mercury. IOP normal range is between 10 and 21. Is the main cause of glaucoma progressing. We should check the IOP whenever the patient comes to the eye clinic. And the glaucoma patients should get visual field exams every 6 months at least to evaluate progress. If there are no visual field test machines in the clinic, we should watch closely the changing of optic nerve by fundus exam. Checking the IOP exactly is very important. There are some kinds of IOP checking methods, like auto reflection machine. There are also auto pneumatic IOP machine. It is easy to check IOP in a short time and it does not need any special skill, but it is also very expensive and heavy. In the right photo, we can see the manual IOP checking method by Swiss tonometer. Using this manual tonometer needs a very skillful ophthalmologist, and during this exam, patient's cornea should be anesthetized for no pain and can be damaged. Automatic tonometer needs a table and the manual tonometer needs a bed to lie. But portable IOP equipment like eye care or tonopen does not need a table or bed. So it is very useful to adapt on some poor systemic condition patients who can hardly sit or lie or move. and it is very light to carry and easy to check in a brief time, although these are expensive too. If we do not have any additional equipment to check the IOP, we can consider this pronation tonometer, which can be mounted to the slit lamp. It has another advantage to adapt on whose cornea state is abnormal or on very high IOP patients. If cornea state is abnormal or too high IOP over 50 mm mercury, it is hard to get the IOP result from auto-pneumatic tonometer. But this pronation tonometer requires fluorescence staining job and only skillful ophthalmologist can do without complications. There are some kinds of objective visual field checking methods and subjective visual field checking methods. We can assume the approximation of visual state by confrontation exam. When examiner and the patients confront between the gaps of 30 cm, they look at other sides. In this state, the examiner slowly moves his or her hand or red cap in his hand at peripheral region. During watching the examiner's eye, if a patient can recognize the movement of the examiner at peripheral area, we can interpret that patient's visual field at periphery looks normal. There is one black dot at the center of the answer grid which looks like some cross puzzle. If some patients feel distorted line or black area when they look at answer grid, we can guess he has some visual field abnormalities. Most common used method to check visual field is Humphrey visual field, and it is standard. Goldman is more useful in who are suffering from diplopia. FDT is faster than Humphrey, but sometimes it is not reliable or delicate. If some patients' glaucoma state is worsening, the visual field narrowing is also developing. In upper pictures, we can see the progress patterns of visual field narrowing in glaucoma. The increasing numbers of black dot means the occupying by the disease on the visual field. Although the eye itself is normal, if some abnormalities happen in the brain, the visual field defect can be made because the eye is connected directly to the brain through optic nerve. The visual field defect patterns are different on where the brain damage happens, so we can predict the brain region by visual field defect pattern. For evaluating not only optic nerve but also retina, the fundus exam is essential. The retina is in the posterior part of the eye, so we can only watch the retina through the specific equipment. The area of the retina which we can watch is different by the type of the equipment. If we use only slit lamp with 90 diopter lens, we barely can see narrow portion of the retina. But if we use specific retinal camera like Optomet, we can see the retina very widely without dilation of the pupil. There are many types of the equipment which help us to watch the retina. The first is the direct ophthalmoscope. It is very light and portable, so it is very useful when we visit the local area to examine who hardly can visit the hospital. We can evaluate the optic nerve state through this equipment, but it is not easy to watch the whole retinal region through this because it only shows us under 15-degree area. So this is useful when we evaluate the glaucoma. The second is the indirect ophthalmoscope. This is composed of two things: head-mounted device, which is a source of light, and the specific focusing and the magnifying lens. For this exam, we should dilate the pupil of the patients. We can see very wide area of the retina at once, and if we want to see the peripheral region of the retina, we order the patients to see some direction where we want to watch. In COVID-19 pandemic state, the eye doctors should wear masks and gloves when doing these exams. The third method to evaluate the fundus is using 90 diopter lens on the slit lamp exam. As I mentioned before, we can only narrow portion with this method, but we can see the retina in detail with this method by controlling the magnification which amounted to the slit lamp. Because the gap between the patients and the eye doctors is very close when using slit lamp, the eye doctors should use not only mask but also the face shield in this COVID-19 pandemic. The first is many kinds of fundus camera. We can obtain the photos from these cameras and restore as a medical record. We can get good quality of the photo if we use expensive camera. But we can also take a good photo of the optic nerve and the retina by some apps like PEK, which can be loaded on mobile phone nowadays. If you want to watch the posterior part of the eye, we should dilate the pupil. Pupil is naturally dilated when we are in the dark area or in danger. But the dilated pupil naturally will be constricted soon when the pupil is exposed to light and stable. So we should dilate and fix the pupil to examine the fundus. We are using some mydriatic eye drops to dilate the pupil. Full dilated pupil size is around 8 to 9 mm, and this can be helped when we are doing the cataract and the retinal surgery. The slit lamp examination is the main exam of the eye. As I mentioned before, we can see the posterior part of the eye with the 90 diopter lens on the slit lamp examination, and we can get the IOP by explanation tonometer. But the main purpose of the slit lamp exam is to evaluate the anterior part of the eye, which include conjunctiva, cornea, anterior chamber, iris, and the lens. Two above photos were taken when I visited Pakistan and China to the cataract surgery through vision care program. Two below photos were taken when I did outpatient diagnosis at Rasdesa Hospital. After the COVID-19, I always wore goggle, mask, and gloves. Slit lamp examination is very essential, but it is very expensive and heavy to move. And some patients whose systemic condition is poor or who are uncooperated due to very young age hardly can sit in front of the slit lamp. In these conditions, portable slit lamp is more useful. But this usually does not have many magnification lenses, so this is just for just screening. For evaluating the cosmetic eye function, we can use many methods. In this slide, I will explain one, the exophthalmometer. In hyperthyroidism, the eye can pop out, and if some tumors are located in the back of the eye, their eye also can be prominent. To examine and compare the prominence of the eye, we can use this equipment. Because the air pollution and using the heater or air conditioner and the computer, eyes are easily dried. In this case, we can consider these exams. And to evaluate the severity of dryness of the eye, we can use many methods. There are so many eye exams, but I'm sorry that I cannot explain all these things in this lecture. There are some different eye conditions between children and adults. In children, the eye abnormalities can happen congenitally, in nutrition deficiency, in visual acuity developing. In adults, the eye disease can happen from age-related metabolic disease like diabetes mellitus. We should consider these situations to examine the eye. In Ethiopia, the eye exam frameworks like this procedure. The interviewer identifies the household members and completes some eye examination form. Then, at 25 cabinets or 25 warrants, 2 stages of observing nurses took some questions and the history about eye surgery and assesses frequent diseases like glaucoma or vitamin A deficiency and check the visual acuity in public health center. But usually there are few or no observing nurses in there, so KOICA and the vision care sent observing nurses or optometrists through the program. At administrative zones or 9 regional states, patients can meet ophthalmologists then. This table shows how the eye tests are done in Ethiopia. Visual acuity was checked by Wilgmar chart and the refraction was checked by pinhole rather than precise exam. For evaluation of glaucoma, they checked the IOP by Schritt tonometer. And to watch the fundus, they use direct ophthalmoscope. This is the sample of the eye exam form in Ethiopia. From 2009 to 2014, KOICA sent 2 Korean eye doctors, Dr. Yoon and Dr. Kim, to Rasdes Hospital as an international cooperation doctor. They settled the OPD and operation room of the Rasdes Hospital in a success during 6 years. Since 2010, KOICA helped the vision care to educate and supply equipment to various hospitals which are located at Addis Ababa and many local cities include Sodo, Diradawa, Zimma, and Ambo. From 2017, KOICA sent another Korean eye doctor, Dr. Lee, to Rasdes Hospital as a global doctor like me. Dr. Lee worked 2 years, and after him, I'm working since August 1, 2019. KOICA made a contract with Vision Care about public-private partnership. From this PPP, KOICA and Vision Care supplied over $200 million for blindness prevention through ophthalmology service enhancement during these periods. Through this money, we can supply many disposables for consumables and equipment for the eye exam and the cataract operation. During the cataract surgery, patients are given eyewear in the eye, and the good quality of eyewear is expensive. KOICA and the Vision Care supply these excellent eyewear with this money, so patients can get the surgery in a very cheap price, around $600 to $700. If there were no support like this, patients should pay over 13,000 euro, about 20 times more expensive for the cataract operation. KOICA and the Vision Care helped the eye service developed in Ethiopia through this project, from elementary school screening to training of Ethiopian doctors, nurses, and optometrists. The main purpose of these projects are improving social awareness and inducing policy change about the eye health in Ethiopia. These numbers and the diagram shows the current 5 years results via KOICA Vision Care PPP. From 2015, all numbers of OPD patients examination, include refraction IOP numbers and the cataract operation numbers are increasing. But due to the COVID-19, all procedures have stopped from April. The Ethiopian government designated Rasdes Hospital and the Menelik Hospital as an official eye hospital during this pandemic. So all eye disease patients should go to only these 2 hospitals. From middle of June, hospitals started only OPD, and from August, they are doing exams and cataract operations because there are so many patients who are suffering from blindness. But there are too many COVID-19 positive patients in Addis Ababa nowadays. The medical staff are very worried about the contagion. KOICA Vision Care PPP have done elementary school eye examination screening through these 5 years or so. We not only did the exams, but also did the education for the teachers and did establishment surgery through this screening. But COVID-19, the schools are shut down, so we cannot go do these things on screening now. As just one eye doctor, I can do maximum 10 cataract surgeries per each day through new cataract surgery skill. But that means I only can help less than 100 cataract patients in 1 month. Compared to all the cataract surgery skill, the new one is better in recovery time and the surgery time and the visual acuity result and the complication. But there are more than 1 million blind patients due to cataract or other diseases over whole Ethiopia country. Actually, the cataract surgery rate in Ethiopia is 576, which means only 576 per 1 million can get the surgery. We already give sufficient help to them through many cataract surgery specialists. So it is very important to train the Ethiopian ophthalmologists, optometrists, and the nurses. Each year, KOICA and Vision Care selected at least 4 doctors and 4 nurses and 4 optometrists and have taught them the new cataract operation techniques through PTC, Bapa Training Camp, and SunTC, Surgery Observing Nurse Training Camp. And through OTTC, Optometrician Training Camp, we also train the optometrists. Through this training camp, we showed how can do the surgery by new technique and taught them from the beginning. We trained them via 4 steps. At first step, we educate the theory, and from the second step, we showed and let them do the surgery under our supervising. Through 4 steps, they can do the new cataract surgery by themselves. For this camp, KOICA sent expert Korean robot doctors and nurses. For the COVID-19, doing the cataract camp like before is very difficult, but we are doing first theory education via online education and the web seminar now. The chairman of KOICA, Lee Mi-kyung, visited last hospital eye operation room and met Dr. Lee 2 years ago. KOICA has shared and donated many PPE, personal protective equipment, to not only Rastes but also many regional hospitals through me and the Vision Care. KOICA gave masks, goggles, face shields, and other hygiene products for the protection of COVID-19. The project of KOICA Vision Care PPP for the prevention of blindness in Ethiopia during 10 years will be done no matter what the COVID-19. But I hope through another ways, KOICA and I will help the Ethiopian to enhance the eye care service continuously. Thank you. I'm a secretary.